was trying to get a sense of where you guys were at and what might be interesting to you. I actually am, as you know, a doctor, and so I look at healthcare maybe a little bit different than an insurer or businessman. And I actually look at it as the relationship between a consumer or patient and their physician as one part of it, but the more important part is as the relationship between the person and their own health and what they do to maintain their own health. And the reason I say that that's more important is that if you look at what determines how long you live, only 10% of that is stuff that we pay for with our healthcare dollars. 90% of that is outside of that doctor-patient relationship. So really, seeing a doctor and what we think of as medical care is a small part of your health in general. And most of your health is determined by things that you do yourself or that no one has control over. Probably 30% is genetics, and so that's luck of the draw. 40% though is behavioral factors, and that means, do you eat healthy? Are you overweight? Don't look at me. Do you smoke? Do you drink alcohol? Do you exercise? Do you use drugs? Do you do dangerous activities? So the biggest part of what controls your health is behavioral. Another probably 10 or 15% is environmental. Another 10 or 15% is social economic, meaning do you have enough money to pay for healthy food and enough money to live and pay for your heat and things like that. And so I say that to people because you have to realize that as a country, the United States spends, I think it's still about $2.7 trillion on that 10%. Now, if you have cancer, that 10% is worth everything because we have great treatments for cancer that we didn't have 30 years ago. And I don't mean to minimize that 10% because at least part of why we live to be 82 on average as women right now as opposed to 56 is because of that 10%. Some of it is environmental and other things as well, but a lot is because of the advances in medical care. And so I don't mean to minimize it, but I do want to say that, depending on who you talk to and how far back you take it, if you want to talk about how can we improve the health of our population, the best way to improve it would be to somehow incentivize eating healthy and exercising and not smoking and taking care of yourself. What's interesting is a lot of those things happen less often in people who are poor. And some of that is just the reality of if you work a hard job, if you work 2 jobs, I don't know if any of you have ever been to Whole Foods, but like many families, we call it whole paycheck. It's not easy to take that kind of good care of yourself, and it's not inexpensive. I think having the time to exercise, I always look at those skinny starlets and say, yeah, if I could work with a personal trainer 2 hours a day, I'd look like that too, Although my aide does it without a trainer, I'm not sure if that's genetics. No. Anyway, but there are a lot of things that it's all interrelated, so it's hard to say one or another. And so, so that's the first thing I want to say about health, is that even though I'm a doctor and I'm part of that $2.7 trillion, a lot of what you can do for your health is completely outside of my control. And in fact, that's part of why I became a politician, is because it became apparent to me working with people in my office that a lot of things that kept them from being healthy were things I couldn't control as a doctor. And so now I'm trying to work on that other 90%, if you will, at some level. But it relates, that information also relates to what Gordon said about what are we doing about controlling costs in healthcare? Because there are a couple of things that drive costs. One thing that people have said to me is that, guess what the most expensive piece of equipment is? Any ideas? A doctor's pen. Because we order all those tests, we order all those drugs, and then those things happen. Because so far most of the really expensive stuff takes complicity from the physician. And so what Lorez was talking about, what Gordon got to in terms of controlling cost, is that the way our system works right now is the best way for a doctor to make money is to see people and do things. If I really manage to help you exercise 40 minutes every day, not smoke, not drink, you know, keep yourself really healthy, you're never going to need to see me and I'm going to go broke. But if your blood pressure's high and I bring you back every 2 weeks, I get paid every time you see me. If your blood pressure's high and I give you drugs, some pharmaceutical company is making a boatload of money off the drug that I'm giving you. So, well, I always use a cheap one, so they're not making a boatload, but volume-wise. But anyway, so the way we pay for medicine is a little bit warped, and I will say that one thing I've learned over the years, and talking with all different kinds of people, not just Republicans, is that the market works right. And what you get more of what you pay for and what rewards people. But unfortunately in medicine what rewards people is doing more things. And so what we really want to do is find a way to reward people for keeping people healthy. And even better, if you can keep them healthy and not do a lot of things, that you get the best reward of all. And so that concept is something I summarize as saying going from volume to value. So instead of paying for more, we pay for good outcomes. And I had the privilege of listening to a gentleman lecture on this about 2 months ago at the Colorado Medical Society. And he was so good that I'm actually having him stop in Denver on his way up to Vail for a Colorado Medical Society event. He's going to do a lecture. If any of you are really interested in health policy and controlling costs, it'll be April 29th at 1:30 at the Capitol in the old Supreme Court chambers. And the title of his lecture is Going from Volume to Value. And so you might have heard the example Lorez gave around how that one institution decreased their costs, decreased rehospitalization by just having 2 phone calls made and making sure that people were okay. So right now in medicine, there's no way to get paid for somebody to do those 2 phone calls. So I don't get paid unless I bring you into my office to see me. And so, in fact, and then if you end up in the hospital, I make more money than if you stay home. So we have it all wrong at some level. You were asking, I think, about medical loss ratios. You know, that Kaiser's medical loss ratio in the Division of Insurance's report was 90%. Kaiser spends 90% of their funds on delivering health care and only 10% on administration. And part of how they can do that is that they're just given money and said, here, with this money, they're not just given, but as part of their deal, the way they work is you pay them money, and with that money they have to keep you healthy, and they can do it however they want. And so Kaiser actually has a very good program for following people up after they leave the hospital. They'll call you within 2 hours, make sure you made it home, make sure you have all your medications, make sure you know what you're supposed to be doing, who you're supposed to see and when, and helping you take care of your own health. Now, at Denver Health, we can't do that because there's no way for us to get paid for that because we're still on that old model of fee-for-service. And in my clinic at Westside, because of that model and the system needing more pay, they keep asking you to see more people. So if you go in a 4-hour session from seeing 8 people to 12 people, do you think the medical care you give is better or worse? Worse. Worse. And not only is it worse, it's more costly. You know why? Because if you come in and you're not looking really good, but I only got 10 or 15 minutes, I'm going to order a bunch of tests so that later on I could look at your blood and say, okay, everything in the blood looks good, it's probably okay that I let her go home without really talking to her and figuring out what was going on. Or I might say, well, let me bring you back in 3 days to check you again because I don't have the time right now to sit, listen, talk, and think about what you're doing. And so that's, I think, become one of the biggest cost drivers in medicine. The other thing related to that is that there are a lot more errors in medicine, a lot more mistakes being made. You read, unfortunately, all the time about people getting too many medications or medications that interact and stuff. And it takes time to sit down with somebody, go through all the medicines and make sure you're getting the effect you want and not a bad effect, and working on cutting them out systematically if you can. But again, if you're being paid to churn out more people, you don't have the time or what was I going to say, reward for doing that. And in fact, perversely, if you get sick, I see you more and I get more money. I mean, it's really twisted. So that's why payment reform is such an important issue in controlling costs in health care. the handout I gave you is, one of the things I got to do, the other reason I came to be in the legislature is because actually somebody gave me a word, I like it, they said that I was a visionary. Because I had a vision for what I thought healthcare should look like in the United States, and I was going to try and push things to make it go in that direction. But what I would really like is that we do have a market in healthcare, but that the market occur between you and me as your doctor, and you as the consumer. Right now the market is between the employer and the insurer, and neither of them can control our behavior. Well, they can try, but they can't. And so I think we need to bring that market down to you and I, where we figure out what we need to do to keep you as healthy as possible, and for me to get the most rewards from keeping you healthy and not doing tests. And so one of the bills I've introduced is it's Senate Bill 168, and it's called the Colorado Healthcare Cooperative, and I have a flyer up here that Healthcare for All Colorado put together for me on that. And really all that bill is trying to do is to get a funding source to pay for figuring out whether my idea would really save money or not. And in it describes what the idea involves. But the idea centers around the concept of everybody having their primary relationship with their provider, whether that's a doctor or a nurse practitioner, and that they work together to figure out